مرحبا دكتورة سهى، كيف حالك؟
مرحبا، أهلا، كيفك؟ شو أخبارك؟
منيح الحمد لله، وأنت؟
ماشي الحال. uh, are you able to share your screen?
Yes, it's enabled for me. Yes,
Okay,
good.
great.
طيب نبدأ على 6 بالضبط، نعطي كمان 10 دقايق I think.
يعني
anyways يعني.
as you wish.
Yeah.
يعني أنا المفروض expected إنه يكونوا على 6 معنا. already
تمام.
في 7،
أمم،
ف5 غيري وغيرك. All school was invited to do so. To join even faculty members. فما بعرف إذا هم رح يكونوا. اللي بيهمنا هلأ إنه في مجموعة من الطلاب المفروض should join. أنا رح أضلني معكم شوي، يعني رح أضلني معكم طول الميتينج، بس لبين ما تبلشي حضرتك.
خلص تمام دكتورة. Thank you. دكتورة، بس كان بدي أسأل شغلة بالنسبة لطريقة الأكسس. الطلاب عم بفوتوا على اللكسي دراج من اللايبرري بورتال من الإي ريسورسز، ولا عم بفوتوا عليها من الويب براوزر؟
لهلا والله
أمم،
I'm sorry. لهلا ما بعرف. يعني ممكن اليوم نشوف إذا
أوكي.
سمحتي. بس برضو why not to share هلأ على الشات. إذا سمحتي اللينك اللي you shared with me.
اوكي. هلا هو قال لك شغله، هو اللينك اللي انا I shared with you. اذا
آه،
هم عم بفوتوا يعني من البيت ما راح يدخلوا عليه، لانه بتعرفي احنا لازم يكون الاي بي عندنا مسجل. اوكي.
أوكي. طيب.
فالطريقه الاضبط للطلاب انه من خلال البورتال تبع الجامعه، لانه اكيد عندهم يوزر نيم وباسورد للاي
for
لايبرري
sure.
ريسورسز. يا
أوكي.
فهي هاي
أنا
الطريقه. اذا فينا نشيكها مثلا بكره الصبح and you can confirm with me، بس
أنا
انا
I can confirm now.
اوكي.
لأنه إحنا في عنا إشي اسمه easy library، واللي هي بنقدر من خلالها
اوكي.
من برات الجامعة يكون عنا access. فخليني أشوف هلا.
طيب بتحبي to share your screen quickly we can look at it.
أنا هلا أوكي، أنا already دخلت على موقع الجامعة فعرفتي.
اوكي.
أوكي. إذا بتحبي هلا أنا I'll share my screen وأرجع أعيد القصة.
اوكي.
طيب. خليني بس أعيد القصة معاكم على why not even to start recording the meeting from now. الساعة هلأ 6 سوري 5:58 توقيت عمان. فأنا I'll start recording the meeting بعد إذنك.
اكيد طبعا.
آه، أوكي. هلا we are recording the meeting eventually، لأنه أنا عملت بالsettings إنه to be recorded. I'm sharing my screen also.
اوكي.
فهلا ببساطة نحن طلابنا بيقدروا إنهم يروحوا على مكتبة الجامعة، وفي عنا هون إشي اسمه إلكترونيك كوليكشن. من برات الجامعة في عنا الديب نوليدج، وفي عنا من برات الجامعة الإيزي لايبراري. جواتها المفروض في عنا UpToDate، مجموعة من الداتابيسز وين أوكي هم رح يلاقوها ليكزيكومب.
أيوة.
أوكي، وهي على طول
ممتاز.
بتفتح ليكزيدراج.
أوكي.
Okay, أنا already I have the app on my mobile. Okay, an error. Okay, it shouldn't be a problem هاد، بس هو ممكن يكون
This page requested could not be found.
هاي بدك هاي بدنا نشيكها مع الدكتور مجاهد يمكن، ولا مع حضرتك؟
اوكي، ممكن تكبسي اي شيء، ممكن تحطي
drug ID.
لا ولا دراج ايدي، فينا نحط بالسيرش اي شيء، مثلا نحط فانكومايسين او اي شيء فوق.
هاي هاي بانكومايسين.
اوكي طيب، معناته يمكن لازم نشوف مع دكتور مجاهد.
يعني now you have the situation الصراحة، فإذا سمحتي هاي المسج اللي كنت بحاول أحكيها إذا متذكرة وقت ما التقينا، أو ما على الإيميل بيناتنا وبين الدكتور مجاهد، ولما التقينا أنا وإنتي ومين كانت معنا نسيت.
ملس اوكي. هلا احنا لما بس انا وياكي لما التقينا اخر مره فتنا بالويب براوزر بالجامعه وفات immediately، فاي ثينك يمكن في شغله بالبورتال باللايبرري.
طيب هاي ممكن can you report it للدكتور مجاهد؟
اكيد طبعا، اخذت سكرين شوتس اكيد، انا I'll send them an email.
بتحبي ارجع لك ولا خلاص you have the screenshot؟
لا I have the screenshots وتمام دكتورة.
اوكي. مس سارة، هلا نحن معنا 35 حدا including myself and you، فإذا بتحبي تبلشي أنا السيشن is recorded، وأنا very much thankful لإلك للمرة الثانية. وبعد إذنك by the end of the session إذا بتقدري تساعديهم يعملوا داونلود، أو يمكن تعطيهم الخطوات وتضلها بين إيديهم، لأنه أنا I'll share the recording للميتينج معهم عشان يقدروا ينزلوا الآب ويستخدموه everywhere anytime and anywhere.
تمام أكيد دكتورة. Okay.
Thank you.
Welcome. So I think we can start. Good evening, everyone. I would like to thank you for joining this session this evening for UpToDate Lexidrug, which was formerly called as Lexicomp. My name is Sarah Adwan. I'm a senior customer success specialist working for Walters Kluwer Health. I'm responsible for UpToDate and UpToDate Lexidrug in the Middle East and Turkey region when it comes to user trainings, awareness, and support to ensure that our users are utilizing these resources to their maximum potential. The purpose of the session today is to walk you through UpToDate Lexidrug, which is available at the University of Jordan. The session will be approximately 40 to 45 minutes. I'll walk you through the different features of the platform. Feel free to unmute your mics if you have any question, and please put the questions in the chat as well. And definitely towards the end of the session, we will have some time. As Dr. Soha said, we will look into the creating accounts of Lexidrug. I'll share with you the steps. And definitely, if you have any questions, I'm more than happy to answer them also towards the end of the session. I'll start by sharing my screen. I do have a few slides. These are just a brief introduction. Once the introduction is done, we will move to the actual Lexidrug platform. Is my screen visible? Are you able to see the slides?
Yes, doctor.
Okay, thank you. So the agenda of the session will be the following. We will start with a brief introduction. We will talk about what is Lexidrug or UpToDate Lexidrug. How do you access it? How do you navigate through the contents of Lexidrug? What is Lexidrug made up of? It is made up of content sets or drug databases. We will look at these shortly. Special charts and topics is a very nice tool that you will have as well, which is available in your subscription. We're going to look at the Lexi multinational. This is one of the most commonly accessed drug databases from within the Lexidrug. We're going to look at the Tristles IV compatibility tool, drug interactions, patient education and calculators. And then we look at the more clinical tools, toxicology, and definitely we will talk about the mobile application, account creation and download. And then if you have any questions, I'll be more than happy to answer. However, before we start, we'll just have a brief about what is Lexidrug. So Lexidrug is a drug decision support tool. It is backed by evidence-based medicine. It is under the umbrella of UpToDate. Lexidrug formerly was known as Lexicomp. I'm not sure if you are familiar with Lexicomp, but we have done a rebranding to Lexicomp, and now it is called Lexidrug, and it is under the umbrella of UpToDate. It can be accessed in many ways. You can have access to it in your library portal. You can have access to it on your mobile devices, and you can have access to it by putting the URL of the Lexidrug in the browser, but you have to be in the network of the university if you want to access it from any browser. It has content sets or drug databases along with clinical tools, and we will look at this shortly. It has a huge number of patient educational leaflets. We have more than 8,500 patient educational leaflets available in multiple languages, including Arabic. It has one mobile application, and the same team that is writing for UpToDate is also writing for Lexidrug. So the content is harmonized across both platforms. So if there is a recommendation, for example, a dosing recommendation in UpToDate, you would find the same one in Lexidrug. The solution is used by more than 2 million clinicians in more than 190 countries. And in Lexidrug, we have more than 150 pharmacists working as full-time staff. I'll move now to the platform, and again, just to reiterate one thing, if you're going to access UpToDate from, Lexidrug from any browser connected to the network of the university, once you access it, this is the home screen. This is how it will look like. You do not have to put a username or a password. You will be automatically logged in to the Lexidrug. The only time that you will have to put or create a username and a password or an account in Lexidrug if you want to use it on the mobile device. Otherwise, if you're accessing it from the web browser, you will be logged in automatically. If you're accessing it from your library portal, you will also be logged in automatically. However, just to also inform you, I think we need to check the access through the library portal, because currently I think it is not working. So I think the only option that you have, if you are in the library, if you are, in the university, to open any web browser and put the Lexi URL. I'm going to put it in the chat just so that you can try this in the morning if you are available at the university. I'm sorry, I think the chat is not open for me. But anyways, I'll be also sharing this with Dr. Suha, and she can share it with you. Okay, this is the home screen of Lexidrug, and this is the clinical toolbar. This is the main search box. We're going to search for drugs, and then I'm going to show you the search outcomes. From here, there is a link to any special alerts, any warnings we want you to be aware of. We will put them in the home screen. From here, there is a link to the training videos, quick reference guides, and the mobile access codes. This is basically the instructions that you need to follow to create an account and download the mobile application. Before we start the search, I just want to make sure that you all know how to find the drug databases that are available in your subscription. From the more clinical tools, you will click on indexes. From the indexes, you will see all the databases that are available. Commonly used databases, for example, Lexidrug's multinational, pediatrics and neonatal. We have the Martindale, we have geriatric Lexidrugs, for instance. We do have pharmacogenomics, natural products database, and much more. So please navigate through the indexes that you have while in the university to familiarize yourself with the available databases. Under every database, you will find a brief. This is basically will tell you what does this database consist of and what is the purpose of this database. So multinational has most or all the drugs that you will come across. Pediatrics and neonatal, this is more directed towards this special population or special age group and so forth. If you click on the database name, so in this case, Lexi Multinational, you will see a page, and this page will tell you all the fields that are available under this database so that you will familiarize yourself with the fields that are available in the Lexidrug's multinational monograph. So you would have things like the generic name, the special alerts, for instance, the pharmacologic category, dosing, and so forth. So these are the description of the fields within the multinational. What I want to mention here is the charts and special topics. This is a very nice tool. It has lots and lots of useful information in form of tables or charts. So things like, for example, benzodiazepine comparison table, things like oral medications that should not be crushed or altered, medications that are inappropriate to be used for kids, Beers criteria, the medications that are not appropriate to be used in geriatrics, and much, much, much more information. Please navigate through the charts and special topics. I am sure you will find useful information that you can apply to your studies or to your clinical rotations. I just want to give one example. So in this case, we have Beers criteria, which is the potentially inappropriate medication use in older adults, older than 65 years. This is a full list of the Beers criteria. You can alternatively type a drug name. You can type some keywords in the main search box. So you can type something like do not crush. If you want to look for a list of oral medications that should not be crushed or altered. Once you execute your search, you will see where the oral medications that should not be crushed or altered is available. So it is available under these three databases. Let's say I want to know this information under the multinational. I will click here and it will take me to the table that talks about oral medications that should not be crushed or altered. And these are the reasons or any comments related to that. So this is a very nice tool. Please make sure to look at the charts and the special topics. Now let's go back to the home page of Lexidrug and we will start our drug search. I'm going to type a drug name. So I'm going to type something like baclofen. Once you execute your search, you will see the list of databases or content sets that includes the baclofen. I'll talk about the Lexi multinational for today's session. The monograph is displayed in this way across all the drugs. We have the outline and we have the text. Any alerts or any warnings, we will put them at the top of the monograph so that you are aware of these issues when you open the monograph. You can definitely find the pharmacologic category. So if you are interested in knowing the pharmacologic category, you can select it from here. And if you click on the skeletal muscle relaxant, you will find also all the drugs that are under this category under the Lexi multinational. So from here, you can access the pharmacologic category. What I want to mention is the dosages, and the dosages in Lexidrug are constructed in a way that it will tell you the indication. Under the indication, you will find the dose, duration, and frequency. So for example, if we're looking at the specificity information, you can see that here, this is the oral dosing. This is the intrathecal dosing and so forth. The content that you see in Lexidrug is fully referenced, and you can see the different references here. You can see them, they are inline, they are hyperlinked in blue. You can click on the reference and you can see the reference. So if you're asked, for example, to find the references or where this information is coming from, you will find it under the reference section. We do have dosing based on the age group of the patient, and if you're dealing with a complex patient, so someone with hepatic or renal impairment, you can find the dosing adjustment information available, and this is based on the creatinine clearance, as you can see here. Clinical practice guidelines. So if you are interested in reading and knowing a little bit more about the clinical practice guidelines, they are also available. You can see them here. Click on the hyperlink and it will take you to the clinical practice guideline. The uses are also there. There are labeled uses and off-labeled uses. You can see the labeled indications, the off-labeled ones, based on a level of evidence. So for example, this is an off-label use, but how strong is the evidence that is supporting it? You can find it here. So for example, let's say muscle spasm or musculoskeletal pain, the level of evidence is B. This is the interpretation, or this will tell you how strong is the evidence with the level B, just so that you are aware about the strength of this off-labeled use. Administration and storage issues is also available. This is a very nice tool. Also, you have the option to look into the administration in case of enteral feeds. This was added recently to our content. Last year, we have added the section related to the enteral feeds. So if your patient is on tube feeding, you can access this information to know more about the administration information. Storage and stability information is also there. We do have the preparation information. So for example, how do you prepare this medication for administration? IV compatibility is also available. And if there's any extemporaneous preparations, you will also find this information here. IV compatibility can be accessed from the monograph itself. You can click on Open Trussa's IV compatibility. Alternatively, you can access it from the main clinical toolbar here at the top. Medication safety issues, so something like high alert, lookalike, sound-alike medications, this will be also available. You do have the section for contraindications, for warnings and precautions as well. This is available for you here. If you are dealing with a pregnant or a lactating woman, you have the information as well. If you want to find in-depth information, we have another in-depth content set or drug database. This is called Briggs Drugs in Pregnancy and Lactation. This will take you to the Briggs Drugs and Pregnancy Drug Database, and here you can find further information related to the use of this medication in pregnancy or during breastfeeding. So this is just to give you further knowledge about the safety or the efficacy or any considerations while dealing with this special population. Adverse reactions is also available. The adverse reactions section is very nice. If there are any significant adverse reactions that we want you to be aware, so let's say you've prescribed or your patient is on baclofen and any of those adverse reactions happen, we put them there because probably they are common. This is something that you want to consider if they happen with your patient. So for example, we might come across CNS effects, we might come across withdrawal effects as well. So this section is very important. Adverse reactions is also there. Allergy information, you can also find it here by clicking on the baclofen allergy link, and it will take you to the allergy information. Toxicology, so if there is any information related to toxicology, related to skeletal muscle relaxants, you can find the information as well here. Further to that, the drug interactions, there's a nice tool here for drug interactions. You can launch the drug interactions tool from the monograph itself. Click on Open Interactions. Alternatively, you can access it from the main clinical toolbar by clicking on the Interactions section. Patient safety management is also there. Any monitoring parameters, so anything that you need to monitor if this patient is taking those drugs, will be available to you under the monitoring parameters. Pharmacology and pharmacokinetic information, this is available to you also here as well. References, again, the content is fully referenced. This is a full link to all the references that were used across this monograph. There are a few things that I want to also show you. I just want to show you one thing. I'm going to type 1 cephalosporin, and this section might be available, or it's available under the majority of the drugs, but sometimes you might not find it under certain drugs. However, if you come across this feature, I'm sure you're going to also like it. It's a very nice tool. Let's talk about cefuroxime. And if we look at the pharmacologic category, again, it will also mention to you that's an antibiotic and which generation it belongs to. Sometimes under the uses, you will find something called class and related monographs. The class and related monographs, this compares the drugs within this class of medications side by side to tell you which is the appropriate indication, and this use, is it FDA approved or this is off-label use. So in this case, I'm going to click on the cephalosporin. And you can see here, this is a table. These are the indications. These are the drugs. And you can see the ones that are FDA approved and the ones that are off-label. This will definitely help you choose the right drug for the right indication. And again, just to reiterate, this information is found under the class and related monographs. You will find this section under the uses. Okay. Any questions so far before we move to the other features? I'm just giving a brief explanation on the monograph, and then we will move to the other clinical tools. But any questions? Okay.
دكتور
Yes. Yes, تفضل.
سمعتني السكرين كانت سلايد يعني راحت.
السكرين أنا مش عم أنا I'm gonna share it now.
اوكي خلاص
Okay. تمام. The next thing that we're going to look into is the clinical toolbar. We're going to look at the Tristel's IV compatibility. Tristel is one of the commonly known industry standards for bringing to you compatibility information. If your patient is taking any IV drugs, any IV solutions, or parenteral nutrition, you may use this feature. How does this feature work? You can type the name of the drug. So for example, ceftriaxone, I'm going to type heparin sodium. I'm going to type dobutamine. And I'm going to type, for example, normal saline, and then I'm going to click on Analyze. What you see here is a table of drug compatibility or incompatibility. This is similar to a traffic light system. If what you see next to a drug pair is red, it means that you stop. This is incompatible. If it is orange, we are uncertain. We need to slow down and think before we administer. If it is green, go ahead and administer these medications. They are compatible. You can look at the methods here. So for example, if I'm interested in Y-site compatibility, I can filter by the Y-site compatibility. If I'm interested in all the methods, this is the full table. Dobutamine and ceftriaxone, if I click on the Y side, it takes me to a page This page explains the different studies that were done to come up with this finding. So for example, here, this is the concentration, this is the vehicle, this is the drug 1, vehicle, drug 2, and vehicle. And you can see the study that was done to come up with this finding, the conditions, what was the container used, the compatibility, the study method, and so forth. Let's take another example. Heparin, sodium, and dobutamine hydrochloride at as an admixture, we are uncertain of their compatibility. You can see here different studies were done. Some of them showed incompatibility, some of them showed compatibility, yet we are uncertain if you can put them together as an admixture. If we scroll a little bit down, so normal saline and, for example, dobutamine hydrochloride as a solution, they are compatible. You can put them together. These are the different studies that were done to come up with this finding. Not only this, you have access to the full Trissels monograph. So under the Trissels monograph, you have information like administration, reconstitution, stability, additional stability, chemical, physical stability, sorption, and so forth. So you have access to the full monograph from the link that you see here as well. If you are interested in individual drugs, so for example, let's say you want to look at dobutamine to see which drugs or the compatibility for dobutamine, you can enter one drug and you can see here the compatibility or incompatibility with solutions and with the medications as well. And you can see here the compatibility and incompatibility information. For example, drugs with as an admixture. This is a full list of the information. Drug interactions is a very nice tool also that you will be using a lot. It tells you the drug interactions, drug allergy interactions, and any duplication in therapy. How does this tool work? You can definitely add over-the-counter medications and herbal remedies. I'm going to type something like ginger, vitamin C. I'm going to type amoxicillin, naproxen. I'm going to type clopidogrel, omeprazole. I'm going to type also diclofenac. And then I'm going to put some allergy. I'm going to say cephalosporin allergy, and I'm going to say milk, for instance. And then I'm going to click on analyze. What you see here is a list of drug interactions based on a 5-tier risk rate. So if next to a drug interaction, what you see is X, we need to avoid this combination. C, we need to monitor therapy. D, we need to consider therapy modifications. A and B, there's no action required from our side. Looking further into the drug interaction list, here there's a drug allergy between amoxicillin and cephalosporin. If I click here, it takes me to a page. This page has a little bit of a discussion, the studies that were done, for example, and a little bit of a discussion about this type of drug interaction, as well as the references. What I want to show you, and let's look at the drug interactions. There's a list, few where we need to avoid the combination, and some we need to monitor the therapy. If we take clopidogrel and esomeprazole, again, the same page, we have a summary, we have a discussion, and we do have some references. However, there's a patient management section. I encourage everyone to read the patient management section. It is really helpful. It gives you some guidance or some hints how to mitigate this potential adverse effect, or, for example, some steps that you need to consider how to manage your patient. If we read through this, and I put clopidogrel and esomeprazole, clopidogrel prescribing information recommends avoiding concurrent use with esomeprazole due to the possibility that the combined use may result in decreased clopidogrel effectiveness. Rabiprazole or pantoprazole may be lower risk alternatives to esomeprazole. Looking at the interaction analysis, again, there's a duplication in therapy between diclofenac and naproxen. They are both NSAIDs. So as a pharmacist, you need to select the right medication. And we do have a nice tool that we will look into shortly to help you decide which medication is better. But in this case, there's a duplication and you need to select either diclofenac or naproxen for your patient. Drug ID is available also, so in case your patient comes to the clinic and they don't know the name of the medication, and they will come with a box full of pills that are colored and I don't know what. So this tool can help you, or it will give you some suggestions what this medication might be. However, this is directed towards international brands, not the local brands. I can type some information such as the physical characteristics of the medication. So for instance, I'm going to say this is a tablet. One of the imprint sides has 100, and then I have the shape as round. I have the color as pink, and then I click on search. This is some suggestions what this medication might be to help you try to know what is the drug that your patient is taking. Patient education is a very nice tool. I encourage you to read through the patient education leaflets in preparation for your rounds, for your internship. They are very nice leaflets. They are written in simple language in a question and answer format, easy to understand, and it's easy for you to explain also to the patient. They are divided into several categories. So under medical conditions, we have leaflets. Under procedures, discharge instructions, healthy living, natural products, as well as adult and pediatric medications. Definitely, you have the option of changing the language of the leaflet. From the drop-down menu, you can see we have the patient education leaflets in these many languages. In this example, let's say I want to give my patient an Arabic leaflet. I can also provide an English leaflet for a non-English leaflet. I can have a signature page. If you have any notes that you want to add on top of the leaflet, you have the option to do so by clicking on the signature page. You can add as many leaflets as you want to your patient. Let's take an example. So I'm going to look at something like colonoscopy. Once I execute my search, it will tell you under which categories it is available. So it's available under the procedures, discharge instructions, and healthy living. Let's look at the procedure, the colonoscopy procedure. I can look at the leaflet preview. Again, this is the leaflet, and it is written in simple, straightforward language. Some of the leaflets that you see would have some pictures just to help you and help the patient understand more about their condition. If you are satisfied with the leaflet, you can click on add to packet, or you can print it directly. Whatever you add into the packet, it will be here. This is like your shopping cart. You add your leaflets and they will be under your shopping cart or under your packet contents. Let's add another for example, drug. So polyethylene glycol is available under the adult medications and the pediatrics. I'm going to add it to the packet. And then once I've added all the leaflets that I want, I can click on preview current packet. And from here, you can type some information. So your name, for instance, your patient name, and any additional free text notes that you want. And you can see here, this is the contents of the leaflets. This is the Arabic colonoscopy. This is the English colonoscopy. And this is the polyethylene glycol in Arabic. And this is the polyethylene glycol in English. And you can definitely print it from here. Calculators are also available in Lexidrug. You can view the calculators by typing a keyword. So you can type something like score, for instance. And this will only provide you with the calculators that have a score in them. Alternatively, you can search the calculators by the categories here. So for example, infusions, you can see all the calculators related to infusions, or you can search through the list by scrolling up and down. Let's look at the infusions. I just want to show you one example. Let's look at the dopamine infusion. Let's say you wanted to find out the dopamine infusion rate. The calculator here will ask you to enter some information. You will have to select the right concentration. So let's say 800 micrograms per milliliter. The weight of the patient, there's a question mark. It will tell you what fields you need to enter or what values you need to enter into this field. So let's say my patient weight is 70. The dose here, it will tell you the dose range. It should be at least 0.5 microgram, not greater than 50 microgram per kilogram per minute. I'm going to type something like 20, and then I'm going to click on calculate, and this is the infusion rate that you will see. If you want to know where we are referencing the calculators from, for instance, and what is the formula that was used, this is the formula or the equation just to help you understand how this calculator or based on which formula this calculator works. From the more clinical tools, we have a drop-down menu. We're going to look at the drug comparison tool. This is a very nice tool if you want to compare any 4 drugs side by side. It's not necessary that these drugs have to be from the same class. It can be just any random 4 drugs that you can compare based on these sections. So based on adverse effects, indications, drug pregnancy, drug lactation, contraindications, drug-drug interactions, drug-food interactions, and drug-alcohol interactions. I'm going to use the example that we have used in the drug interactions example, which is the naproxen and the naproxen and the diclofenac. Just to compare them, just to show you how the comparison works, I'm going to click on compare. This is the table, and here you can see the adverse effects. You can see the more frequent ones, the less frequent, the rare ones, for instance. You can scroll also down to see the indications. So for which indications these drugs can be given. You can definitely jump to a section immediately rather than scrolling up and down. So if you want to look at the use in drug lactation, for instance, diclofenac use cautiously. Naproxen, it is not recommended. You can click here. It is hyperlinked. It takes you to a page. Again, this gives you further comments or explanation. What is the severity level? So this is to be used cautiously. This is it excreted in breast milk? It says yes, and these are some comments also to help guide your decision if you decided to use diclofenac for a breastfeeding woman. The next that I want to show you is the toxicology. Toxicology is a very nice tool if you want to know more or how do we handle patients during a clinical emergency. This tool is available for you. It has 2 databases or content sets under this toxicology module, which is the household products database as well as the LexiTox. The household products database will give you information about household products that are available at your home, which might cause toxicity. It will just give you an overview, the ingredients of this household product, but the LexiTox will give you the in-depth information related to how your patient presents to the clinic, how you limit the exposure, how you treat. If there's any antidote, it would be also available for you. I'm sorry, I have to just stop for 1 minute. If you can excuse me, just 1 minute, please. Sorry for that. I'll just go back to the Lexidrug. So just looking at the toxicology module, I'm going to show you how do we search through this database. Let's start with the household product. So I'm going to type something like Clorox, for instance, and I will execute my search. Once you execute your search, you will see all the household products that has the Clorox in them. Let's look at the laundry bleach, for example. You will see here, this is an explanation about the product. What I want you to look into is the ingredients. There are two ingredients available in Clorox. One of them is an inert ingredient. The other one is the sodium hypochlorite. The hyperlinked one is the one that causes toxicity. If I click on the sodium hypochlorite, it will take me to the Lexitox drug information page or database. The monograph here looks a bit different. It has more information. So you can see information like clinical presentation, how toxicity happens, how do we diagnose the patient, how do we limit the exposure. The treatment would be the part that you will be interested in. Stabilization, decontamination, antidotes, for example, is also available to you here. Pharmacologic and non-pharmacologic supportive therapy is also available. Let me give you another example, and here I want to show you the antidote. So in case of acetaminophen overdose, for instance, you will go to the treatment and you will see that we do have an antidote where applicable, which is acetylcysteine. You can click on the acetylcysteine. It will take you to the Lexitox page, and here you will see the dosing based on the age group of the patient. So for example, in pediatrics, I can access the acetaminophen overdose. If I scroll a little bit further, we should find the information related to the dose frequency, if there's any loading dose, maintenance dose, and so forth, and you can see the references. Once you are done from the toxicology module, please make sure to click on Leave Toxicology Mode, and you will be going back to the main page. Otherwise, if you continue under the Lexitox toxicology module, you will only be searching under two databases, which is the household products and the Lexitox. The last tool that I want to talk to you about is the advanced search tool. This is a nice tool if you want to look for specific information. So for example, if I want to look at the drug interactions in a certain database, so for example, drug interactions with Lexidrug multinational, with, for example, aminophylline, let's say. Or let's say amoxicillin. Sorry. Let me just make sure that I have the spelling correct. Okay. Because this one requires that you should have the correct spelling. So let's say the drug interactions limited to the geriatric Lexidrugs, for instance. And here you will see all the drugs that interact with amoxicillin. Let's look at the allopurinol, for instance. And it will take you to the amoxicillin and allopurinol interaction in that monograph. So this is more of like a specific type of search within the Lexidrug content. Okay. Before we move to the last part, which is the mobile application download, does anyone have any question? Because what I'm going to do next, I'm going to show you the mobile application and how you download Lexidrug on the mobile app. Okay. Let's move to the part that is concerned with downloading the mobile application for Lexidrug. Let me just show you one thing. Now, there's 2 steps in order for you to download the mobile application for Lexidrug. First of all, you need to be connected to a desktop. Not necessarily that you have to be in the university. You can do this even if you are at home now. You need to access the create account for Lexidrug page. Once you access the web site, it looks like that. It will ask you to create an account. You need to put your first name, your last name. It asks you to put your occupation. So you will say, for example, pharmacy student, your practice setting, you are in an academic institution. How did you hear about Lexidrug? And then it will tell you your country. You will put Jordan. Email address, this will be your university email address. Put your password, confirm your password, and then you click on create account. Once you create the account, you need to log into this account. You will put your email address, you'll put your password, and then you will log in to your created account. Now, this is the step that I want everyone to be paying attention to. Once you log in to your created account, you will see a page that looks like this. It will ask you to add a subscription by code. The code here that you see is specific to the University of Jordan. This code will change every year whenever the university renews the Lexidrug subscription. However, since this is the first time and you are creating your accounts, you need to add this code. You will put it here, click on add subscription. What happens next? You will receive an email, the email that you use to register for an account. You receive an email. The email will have a PIN code. You need to copy and paste this PIN code in the page that you see here. And then the application or the account creation is completed. And then you can download the mobile application on your mobile device. Just make sure that you have the correct code, which is for the University of Jordan. You need to do this step before you download the mobile application, because if you download the mobile application now without creating an account, without activating your subscription, the Lexidrug on the mobile will not work for you. Did anyone have any question? Okay. I'm not sure if you got the steps for downloading the mobile application. If anyone is interested, we can try to create an account for them, and we can activate their subscription so that the others can see this as well.
أني volunteer يا شباب وبنات. في حدا بيتبرع ينزل الموبايل اب؟ اوكي.
أنا بنزل دكتورة.
تمام. تقدر تشير السكرين؟
سيف. سيف قادر تعمل شير للسكرين بليز؟
شوي أشوفها.
اوكي.
على الموبايل دكتورة مش على اللابتوب.
انت مش على اللابتوب؟ لا، بفضل انك تكون على اللابتوب.
تمام.
بدنا حدا على اللابتوب بليز اذا في مجال.
شكله بس انا اللي على اللابتوب وانا عملت داونلود للموبايل اب اوكي.
في أي حدا تاني على اللابتوب بيقدر يفرجينا بس to volunteer عشان أصحابكم يشوفوا الستبس؟
سيف بتقدر عندك access على لابتوب هلا؟
دكتورة بس خليك معي شوي.
تمام.
please سارة.
دكتورة بتقدري to enable الchat for me? I think I'm not able.
I tried والله.
ها
بس
طب
I
اوكي
couldn't لأنه
طب
يمكن أنتي سارة you are not on the group what we can do إنه أي شيء بدك إياه please send it
هم.
whether WhatsApp ولا إيميل هلا وأنا رح أحطه.
طيب اوكي طيب ماشي
وبعد
حاضر.
إذنك مس سارة بس meanwhile بنات وشباب إذا سمحتم أنا I left الفورم تاع الإيفالويشن للسيشن على الشات please go and evaluate the session أوكي عشان نقدر برضو نبعث لكم الريكورد تاع recorded lecture إذا سمحتم. تفضلي سوري قاطعتك.
لا لا ابدا، رح ابعث لك اللينك اللي لازم يفوت عليه save to create الاكونت على الايميل على اساس تحطيه بالشات لو سمحتي.
اوكي
عشان انا بالنسبه لي I cannot share this with him unfortunately. اوكي
سيف بعثت لك ايميل مس سارة.
تيمز دكتورة بعتيه تيمز.
يس سيف بعثته تيمز انا عم بجاوب وانا ميوتد سوري.
اوكي دكتور اعمل شير سكرين
تمام اوكي يلا so let's go through the steps together.
دكتورة فاتحين الشير سكرين الكل صح انتوا؟ ها خلاص موجود.
يس سيف again للكل.
تمام دكتورة طالع عندكم؟
طالعة تمام
Yes.
اوكي فيك اوكي تحط your first name please. اوكي فيك تكتب pharmacist حط P. sorry you're a pharmacist صح؟ اوكي تحط اكتب P على الكيبورد ممكن المفروض انه يوديك للفارماسيست. اوكي pharmacist academia yes. practice setting كمان academic institution اول وحدة. أيوة تمام. تمام. How did you hear about UpToDate Lexidrug؟ خلينا نقول من الدروب داون، نقول مثلا through the webinar. كمان آخر واحدة. أوكي country جوردن. أوكي. نعمل بس accept. أيوة. أوكي. إيميل أدرس، إيميل الجامعة.
سيف إذا سمحت جيو.
تمام دكتورة هيك.
أوكي create an account.
بس ما بعرف شو اللي بصير. ها
طب أنت حطيت الإيميل صح؟ can we scroll up بس خلينا نشوف شو عم بصير. في إشي فوق لازم يتعبى or something. أوكي everything is fine. الإيميل مزبوط.
يس.
أوكي نعمل create account. طب فينا نعمل refresh بس نحاول مرة تانية.
تمام دكتورة.
please sorry.
اوكي.
سوري تخلي بس الاسم كامل يعني سيف الدين، ما نحطش بس فراغات بليز.
دكتورة كأنه الكونتري مش طالعة. بس
لا
جوردن.
بدك تطلع فوق.
خلص هي خلص تمام.
اوكي.
أحط هون required by أو
بليز
acknowledge that
يس.
by.
اوكي
تمام.
الايميل ادرس. الباسورد بس هي فيها upper case و lower case وكل هاي الاشياء.
آه آه
اوكي طيب خلينا نعمل create account. اوكي في شغله الايميل معلش نخليه مثلا سيف نحطها small letters بس I just want to make sure انه.
أنا غيرتها لأنه كانت سمول وما زبط أول مرة.
طيب هلا اذا ما زبطت ممكن نشوف، ممكن نجرب بالايميل تاعك البيرسونال اذا ممكن، اذا في اشي.
تمام.
طيب خلينا بس هلا نجرب محاوله اخيره نحط الباسورد بس تكون 8 characters upper case lower case وكل هاي القصص ونمبرز. طيب جرب بايميلك الشخصي بليز بدل ايميل الجامعه. اوكي
عادي أخلي نفس الباسورد.
خلي نفس الباسورد. هو عم بيعطيك فينا نرجع للايميل ادرس، عم بيقول لك شيء، اذا بس عم تكبس على الايميل ادرس عم بيعطيك مثل مسج. نروح بس على الايميل
مثلا
ادرس.
هاي الايميل ادرس.
أم... جيميل. طب اوكي. فيك ترجع تكتبه مرة تانية؟ طيب نجرب create account.
طيب دكتورة اعطيني باسورد من عندك.
لا هي ما دخلش الباسورد. ممكن تزبط اي باسورد بس.
دكتورة،
تفضل.
أنا بعتقد إنه زبط من عندي، maybe I can try share my
طب
screen.
اوكي share your screen please. yes. طب سيف فيك تجرب بكرة من الجامعة please while you are connected to a browser، بس تفوت على نفس الويب اللينك please.
تمام دكتورة.
اوكي لو
من
سمحت.
جوا الجامعة
بالجامعة جرب بالله من أي براوزر عندك إياه.
تمام.
اوكي.
Okay, you can see my screen, right?
yes we can see your screen. ايميل already exists. انت already هلا عملت account صح؟ لانه هون هي to email address already exists، فانت عندك account already. اذا عندك account وحافظ اليوزر نيم and password تاعيتك فيك تروح على اللوج ان من تحت.
اللي هذا اللي صار لما عمر هيك عمل قلنا انه زبط معه، فاعمل لوجين بليز
اعمل
عمر.
لوج ان معناته. اوكي.
كريت يلا.
ممتاز. شايف الكود اللي اظن دكتورة سواء غلبك، بس اذا ممكن تبعتيه ل عمر بليز، او بتعرف شغله انا حنقلك الكود.
اوكي
انقلك اياه بس بليز كله كابيتال. اوكي. كابيتال سي، كابيتال ان، كابيتال اف، 29، كابيتال دبليو، كابيتال اف، كابيتال سي، كابيتال ان، 4، وكابيتال سي كابيتال اف. اوكي. واد سبسكريبشن. اوكي. هلا حيجيك ايميل على الايميل اللي انت حطيته اللي هو تبع الجامعه الاردنيه هذا. اوكي. حيجيك ايميل فيه بين كود، بس تعمل له كوبي اند بيست.
وصل يا عمر.
طارق عمر وصل البين كود.
دكتور إذا أتوقع كل شيء بيكون
سوري عمر، ما وصل الإيميل تبع البين كود. ممكن يكون على الجانك فولدر، أحيانا بيروح.
عمر
اوكي he was muted. ما في I checked بس ما وصلني شيء، ما بعرف.
يا على الانبوكس يا على الجانك، أو على السبام من والترز كلور.
شيكت برضه ما بعرف.
طب تعمل له بس ريفرش، أحيانا ممكن ياخد دقيقتين.
ممكن اغير الايميل احط
لا
البيرسونال.
لا لا لا، أنت هلا أنت ماشي صح خلاص، يعني إحنا بس بدنا البين كود.
اوكي
حيجيك من لكسيدراج موبايل اكتيفيشن بين.
لا مش وصلني شيء، ما بعرف.
طيب
اوكي، على كل اذا وصلك هو البين كود حيكون available for 30 minutes. اذا ما وصلك بليز بس بدي تبعت لي ايميل على اساس احط تكت للسبورت، لانه المفروض انه we're done يعني.
اوكي
فإذا ما وصلك من هون ل 5 to 10 minutes، sorry دكتورة سهى، بس if you can pass my email to عمر
Yes.
and I'll raise a ticket. بس anyways for everyone، يعني الستبس هيك، هاي هي الستب الأساسية. once إنه بوصلكم البين كود حتحطوه بهاي الفيلد، وبعدين خلص ال creation of the account is done. بعدين بتقدر تنزل التطبيق على الموبايل. اوكي، في أي سؤال؟
You have Miss Sarah's email. Please contact her عشان إذا ما وصلك within 30 minutes هي أو هو الكود will expire in 30 minutes. within 30 minutes إذا ما وصلك contact Miss Sarah.
اوكي اوكي تمام.
Okay. Safe please بكرة try downloading the mobile app و let me know. Update me please.
تمام دكتور إن شاء الله.
اوكي، وونس شباب او بنات يكون في حدا بيقدر من الجامعه اتليست يعمل له داونلود للاب، بتقدروا كليتكم you can download it and use it wherever you are. اوكي
great.
اوكي دكتور.
بتول تفضلي، في عندك سؤال I think، تفضلي.
يس، هلا لما يخلص السبسكريبشن كود او يصير expired الكود، كيف بنقدر ناخد الكود الجديد؟
اوكي، هلا انت في شغلتين، احنا رح نبعته طبعا لدكتوره سهى she can share it with you whenever the subscription is renewed. في طريقه تانية، هلا بكره بس تروحي على لكسيدراج من الجامعه من اي براوزر وتحطي اللكسيدراج ويب سايت. بالهوم بيج، خليني بس اشير ماي سكرين just so that you are aware. اوكي، خليني بس افرجيكي شغله. اوكي، هون طبعا عندكم بالاكسس تاعكم بالجامعه رح تلاقي شيء اسمه موبايل اكسس كود. اوكي، بالموبايل اكسس كود شفتي هاي الانستركشنز اللي احنا مشينا فيها مع الشباب هاو تو كرييت ان اكاونت، انت فيكي كمان تفوتي عليها من هون وتشوفي الكود الجديد او اذا الكود تغير او لا. اوكي، سو بكره من الجامعه بس تفتحي الهوم بيج حيطلع لك هون شيء اسمه موبايل اكسس كود، من هناك بتقدري تعرفي الكود شو هو.
تمام، شكرا دكتور.
عفوا. في أي سؤال تاني؟
دكتورة أنا عندي سؤال.
تفضلي.
هلا أنا عملت له داونلود وعملت كل الستبس وكل شيء تمام،
امم
ونزلت الموبايل ابلكيشن،
ممتاز.
بس طلع لي إنه in order to use it لازم أنزل إشي من إنه
اللايبراريز بالضبط.
for
اوكي
offline use.
هلا شوفي شو
مش عارفة
بتعملي.
إنه في وحدة أحسن إنه preferred إني أنزلها ولا عادي أنزل أي وحدة ولا ما
هلا
عارفة.
شوفي شو بتعملي. اذا هي طريقه انه انتم اذا بدكم تستخدموا الكونتنت لازم اول شيء تنزلوا اللايبرري او الدراج داتابيز. هلا انا كنصيحه بفضل انكم تنزلوا اللكسي مالتي ناشونال. تمام، اول إشي اعملوا لها داونلود، والدراج انتر اكشنز مثلا والاي في كومباتيبلتي بفضل انه هدول الثلاثه تنزلوهم. بعدين بس تحسوا حالكم صرتوا فاميليار اكثر، ولا تسي انت مثلا بتحبي تستخدمي البيدياتريكس اند نيونيتال داتابيز بتنزليها. ما تنزلوا كل إشي من اول مره، نزلوا بس المين 3 اللي هن انتر اكشنز واي في كومباتيبلتي والمالتي ناشونال، وبعدين as you familiarize yourself with the application نزلوا اللايبرري اللي انتم بدكم اياها.
تمام thank you.
Welcome. Any other questions?
اوكي، في أسئلة تانية بنات شباب؟ I think everybody is satisfied with what you have delivered, Miss Sarah, وإن شاء الله إنه they will download it and make the best use of it. please بنات وشباب keep me posted بأي مشكلة بتواجهوها عشان أنا to contact أو مس سارة أو أعطيكم الإيميل تاعها عشان to contact. Okay?
أكيد. تمام. Thank you دكتورة. Thank you everyone and have a lovely evening. Thank you.
Thank you. Please بنات شباب إذا سمحتم evaluate the session. thank you Miss سارة. هلا صرنا أكثر من ساعة و10 دقائق عم نحكي، your efforts are greatly appreciated. hope to see you again في sessions تانيين. Thank you.
أكيد. Thank you. Thank you everyone. Good luck. Thank you.